it's not a simple process. You have to look at all of those things. Taking somebody who's got high blood pressure, and if you did nothing else but make them walk every day slowly, start out with a little bit of time coming back, starting clean their diet up, watching the salt that's in their food, just those steps all by themselves will take the majority of high blood pressure patients and begin to see some results. They'll start bringing it down. Now you've got to take a look at other medications they're taking, because often blood pressure that begins to elevate is a response to medications that they're taking, and then you have to take another medication to bring that down. There's something called metabolic syndrome X, which we see a lot of, and that's when blood pressure starts slowly creeping up. You see blood sugar slowly start creeping up. You see cholesterol slowly start creeping up. When you see all three of those things, that's called metabolic syndrome. What that means is the body is starting to break down, and the stress patterns, structural injury, dietary patterns, emotional stress patterns have got to the place where the body can no longer handle it. And the inflammatory levels are really high. You're not getting transport of different hormones in the body. Insulin, for example, and thyroid hormone and adrenal hormone are all dependent on the ability to get into the tissue to work. But if your inflammatory levels are high, then none of that's going to happen, and you're going to start seeing all of this creep up. So the difference in spreads of blood pressure, whether it's the diastolic is high or low, or the systolic is high or low, has many different. Why is that? So you have to look at the patient. We take blood pressure in 3 different positions. We take it in a sitting position, then we lay the patient down. We take it in laying position, and we have the patient stand up, and we take it in a standing position. We do it in rapid succession. The reason we do that is it tells us different organ systems that may be involved in that hypertension. So you have to take each person individually. You look at their weight, you look at their stress levels, you look at their dietary patterns, you look at other metabolic situations that are going on, and you have to treat the person as a whole. And that's why it's so important to look at not only what the blood pressure is doing, but where you want to take that blood pressure. Does that help, Mary?
Yes, it does. What really surprises me is that I will have very high blood pressure, both systolic and diastolic, and then 3 days later I'll have very low, like 103 systolic over something. And I don't understand that, why it goes very high, really high, and then really low.
The first thing that I'm going to check out with you is the parasympathetic nervous system, which is the nervous system that controls the internal portion of your body and responds to its external environment. Second thing I'm going to check out is your kidney. And third thing I'm going to check out is your acupuncture system. All 3 of those things will do exactly what you're describing.
Thank you very much. This is the first explanation I've ever had, and I'm including cardiologists.
Well, sometimes, cardiologists are good people. They're very well educated, but they get compartmentalized. They get stuck in a box, and they don't look at the entire system. When we're looking at a problem, you have to look at not only the things that cause it, which is structural injury and dietary patterns, exposures environmentally, and stress, but you also have to look at the systems in the body, the nervous system, blood supply, lymph, movement of acupuncture energy, the movement of spinal fluid. Any of those things can cause a problem. You have to identify which one of it is. And unless a patient is put on the proper path, then you're stuck with medications trying to put a symptom out or put the local fire out when the blaze is burning all over the place. So if I can be of help to you, Mary, please give me a call. Thank you for calling.
Thank you so very much.
You're welcome. Happy New Year. 888-630-9625. We're talking about how to set your goals for 2011, how to get your body back the way it needs to be. We were talking about inflammatory response. And my goal, as part of my healthcare regime starting this coming week, and I have an appointment to get it done, is I'm going to be doing a full-body thermographic imaging. And it picks up not only the beginning stages of cancers, 5 to 8 years, particularly ladies if it's breast cancer, but inflammatory reactions anywhere in the body. And it's a must-do for me. It's one that I will do before anything else, including blood work, and including finding out what my body strength is and what my blood fats are and all those kinds of things. But anyway, we want to encourage you to get a hold of Thermography Centers of Fairfax, get a hold of Dareth Painter, and Thermography Centers of Fairfax this month in January is offering a full body scan, a full thermographic imaging for $400. Normally it's $475. They want to encourage you to start out the new year right. I would make that part of your healthcare goal coming up right now. Give them a call, 703-943-7248. That's 703-943-7248. Want to encourage you also to go to our website at rosellecare.com and check out our wellness partners generally. And that website will lead you to a lot of different places. I would encourage you to do that. It'll help you along this process. We're talking about goal setting and the steps that you need to take to change your life, to change the things that have happened to you, and truly make a difference in what you want to achieve in 2011. You have to know what it is that you want to become. It's not a matter of doing things to get there. It's knowing what it is that you want to be. You have to create that canvas. You have to create that vision, and you have to do it very specifically. If you don't do that, you have nowhere of traveling to. You have no roadmap. You have nothing that you really are looking at. The body is very specific. You know, I want to drop my blood pressure. Well, yeah, to what? I want to get my weight down. Don't say you want to lose weight, and don't say even you want to lose 25 pounds or 80 pounds. What weight do you want to become? But more importantly, what body fat level do you want to? Right now, I've got a list of things. I want to have a certain body fat. This year, for me, is going to try to get my body fat down to 10%. I got a little lazy this last year, and it went up 2, 3, 4, 5%. So I've got to get it down. It's only because I haven't been working out quite as hard as I normally do. I've been working out all the time, but not like I used to. I'm going to change things that will move me towards that because my vision of accomplishing that is very specific. It's very clear. You have to make sure that your vision is very clear as well. And you have to know what it looks like. You have to get an accountability partner. You have to bring around you the resources that you need to accomplish that. Where's the gym? You know, where's the health food store? Where's the structural person that's going to take care of you? The chiropractor, the acupuncturist. Where's the massage therapist? And begin to set that up to begin to restore your health. Obviously, you know that we'll help you any way that we can possibly can, and we encourage you. You can give us a call at our office, 703-698-7117, or send me a note on rosellecare.com, and I'll get back to you. But this is about you. 2011 is about you. You're listening to Dr. Tom Roselle Live. We have been in studio today at 888-630-WMAL and talking about your health goals for 2011 and how to put them together. It's an important step. It's a decision that you have to make, and that's where it all starts. It's a decision. I want to do. I want to become, and you have to get as clear in detail as you possibly can. It has to be a decision. That is the deal. Decision means to cut off from any other option, and then you have to take action, and you have to know what it looks like. You have to create your plan. You have to know what you're going to do, and you have to chunk your plan. It's not going to be huge things. You have to have projects, and you have to have these, these little pieces, and one step at a time. But every time you do that, you have to have in your mind's eye, you have to have the vision of what it is that you want to do, how you want to do it. And then here's the important piece. Here's a very important piece. Timetables. It's not someday It's not I'll get there when I can. Or, next week will be a good time to start. I've got this party in a month, and after that I'll be okay. It has to be about what are your timetables for doing it. And then you have to accomplish whatever it is that you set out to do incrementally, small pieces at a time with the timetable. I don't care how busy you are. None of you, most of you aren't anywhere near as busy as I am and what I do on a day-to-day basis. The patients that I see, the charity that we work with, the consulting practice that we have, the different things that we get done, my lecture schedule, I'm on the go all the time. I'm on the road all the time. I eat out far more than I should, but I pick the restaurants very carefully, and I eat very, very carefully. And I'm going to tweak my life this year. I'm going to make me better than I've ever been. I want you to make that decision for yourself, and I want you to give yourself some timetables. So we have to decide what it is that you want to accomplish, and you have to describe it in detail. And what it is that and you're in the process of becoming, not moving away from. Remember we said that we want to move towards, not away from? What do you have around you that's going to help you get it? People, money, parks that are around you. You don't have to have money to do a lot of these things. and decide how you can break them down into small little pieces, things that you can actually do. Maybe your whole exercise is walking up 3 stairs and walking back down 3 stairs, walking up 5 stairs and walking down 5 stairs. Maybe it's going out and walking outside for 3 minutes and coming back 3 minutes, and then adding on to that. Maybe it's eliminating that second cup of coffee and adding a glass of water. Maybe it's just getting up in the morning, instead of having a cup of coffee, it's having 15 to 16 ounces of water first and then having your cup of coffee. You know, a lot of patients who argue with me and say, I can't give up my coffee in the morning. I say, okay, I want you to do something for me. Before you have that cup of coffee in the morning, I want you to drink 16 ounces of water with lemon in it. Do that first. Would you do that first? And we argue with that. That's not a hard thing to do. I want you to do something that will move you closer to what it is that you want to get done, who you want to become, and get yourself an accountability partner. Make someone else besides yourself responsible for what you're going to do. You know why? Because you can't trust you. None of you can be trusted. Not to keep it up. Because if you could, you'd already be there. You'd already be where you wanted to be. So get somebody to hold you accountable. Here's something that I do every year, and I'm going to encourage you to do. Make a goal board. Go get a big board from one of the stationery stores, and, you know, like 2 feet by 3 feet, and then put pictures of all the things that you want to accomplish on that goal board. I hope 2011 becomes the most productive year that you've ever had in your life. And if we can help you, if we can be instrumental in helping you and being part of your accountability partnership, we'll be glad to do that. You need to go to my website at rosellecare.com and buy my book, because everything we talked about today is laid out very specifically. And I will help you. Go to rosellecare.com, leave me a note, and I'll do whatever I can to make a difference in your life. That's why I'm here. That's why I do this program every Sunday at 12 o'clock, because I want to help as many of you as I possibly can. Have a great year. See you next week.